Hi, I'm Dr. Nichelle Haynes,
I'm Dr. Kristen Lassiter,
and we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
meaning mental health in relation to reproductive hormone changes such as around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
I think this is a good video because it's a confusing thing. Even when we were talking about, okay, how are we going to explain some of these nuances? We were like, but wait, hold on. So we're going to talk about the difference today between a coach, a therapist, a psychologist, and a psychiatrist. Okay, so let's start with a coach or a life coach or a health coach or whatever kind of coach.
So a coach doesn't have to be, they're not licensed. So in a lot of professions, you have to get licensed and you have to register with your state, and there's exams you have to do and criteria you have to meet. A coach, you don't have to do any of that. And anybody could be a coach.
Your mailman could be a coach, or your cardiologist could be a coach.
And they don't need any kind of specific training to be a coach either.
I think there are some training programs that they can do, but I don't think it's a requirement that you do any specific or even a program to be called a coach.
Yeah.
At this point, when we're making this video, I think there's some movement to start regulating that because people are seeing that there is a wide variety, just as in any field, there's a wide variety of training and expertise and benefit that you could get from it because it's not very well regulated.
Anybody could be a coach.
I've seen a coach before, working through some professional stuff with how to grow business or things like that. So I'm not here to say that it's not beneficial. It's just, it has its place, and sometimes that is or is not mental health related.
Mm-hmm.
Yeah. Or a therapist.
They could be a licensed clinical social worker, a licensed professional counselor. There's lots. Yeah.
LCSW.
Yeah. Family therapist, licensed family.
LMFW.
So basically they're licensed. They're licensed in their state. Mm-hmm. They've had education and training in therapy and different therapy modalities. So they've worked under supervision of another therapist. So they spent hours and hours training in what they're doing. A lot of them, I think most of them, you have to have a master's degree. So yeah, lots of education and training and regulation that goes into being a therapist.
Mm-hmm. Right, and continued education. Yes. They have to have continued education to continue to have their license, at least in Texas, I know.
Yeah.
Probably all states do it that way.
And there's certain ethics that they have to follow, rules and regulations.
Yeah, just a lot more regulated, so you get a little bit less variety in training and practicing in an evidence-based way, I think, than a coach maybe.
Right, yeah. Definitely.
Each individual is going to be different, of course. You may have encountered not awesome therapists, but the regulations should be very similar. Okay, so psychologist. Psychologists and psychiatrists get confused all the time. Even people who went to medical school be like, oh, you're a psychologist. No, not. I had this crisis in my life, personal anecdote. I had a crisis in my life where I was like, oh, am I going to be a psychologist? Am I going to go to medical school to be a psychiatrist? I really didn't know what I was going to do for a short period of time in college.
They're very similar. So they both have doctorate degrees. Like a psychologist goes through school all the way up into their doctorate level. So they can be a PsyD or a PhD. And they also have countless hours of training and education in psychology. Mm-hmm. And they don't prescribe medication typically in most states. So they don't typically have the training and education in the medical side of things in terms of prescribing and disease states and different medical disorders.
Interactions, all the things that happen that we think they're like in our heads. Yeah. Okay, so a psychiatrist is a medical doctor. We went to medical school. What I tell people is I could have chosen to be a surgeon. I could have chosen to be an OB-GYN. I could have chosen to go be a cardiologist or whatever field of medicine that I wanted to choose, but I chose psychiatry.
Yeah, so you go through medical school, and then from medical school, you can choose which type of doctor you want to be. So, psychiatrists go through what we call psychiatry residency training. It's 4 years. They can also choose to do a fellowship afterwards and get additional training. And traditionally, psychiatrists are trained in different psychotherapies, so they can do therapy with patients, and they're also trained in medical prescribing, so they can prescribe medicines to patients, they can diagnose and treat different disorders. And yeah, it's a little bit more of the biological and the psychological mixed together.
Biopsychosocial. That's the whole thing. Yeah. I think the big difference is medical school and being able to prescribe medication and having a biologic basis for other things. I've diagnosed thyroid problems. I've diagnosed all kinds of other medical issues that sort of look like psychiatric issues, and that's the benefit of seeing a physician.
Yeah.
Yeah. Okay, hope it was helpful. It's really confusing sometimes, so now you have the information. Use it however you would like to. We're really glad you're here. Please like, comment, subscribe. We'll see you soon.
Bye.